So hello to all the viewers. With me, I have Dr. Ankitesh, who has secured an amazing rank of 58 in the NEET SS medical group entrance exam. Well, in such a competitive exam where you have candidates preparing for all the super specialties, 58 is an outstanding rank at the national level.
Thank you, sir.
So hearty congratulations to Dr. Ankitesh.
Thank you, sir. Thank you.
So how are you feeling now? Because I hope you realize the weightage of this rank, because it's a combined rank. It's not
Yes,
just
sir.
for one specialty. So what is the initial feeling?
Sir, yesterday when I got the rank, I was ecstatic at first, and because this is my first NEET which I've given. So
Okay.
and since it was the first time they were like holding it for all the people combined together, so initially I knew that 58 is quite a good rank. Then I got to know what my friends and all have got. So I was very happy. Like we've all done well, and so.
So, all right. So just tell us a bit about yourself, your MBBS, and subsequently your MD.
So I did my MBBS. I'm in 2013 batch from Maulana Azad Medical College, and then in 2019 I joined MAMC only as MD General Medicine, and I finished my MD this year in April.
All right. Okay. So to begin with, Ankitesh, there were a lot of uncertainties on the exam question pattern, being the
Yes, sir.
first ever medical group exam. So first of all, can you briefly outline to the juniors that who are going to give the exam next year on the general pattern of the medical group exam?
The exam mostly it was equally divided between all the subjects. That's what I thought, and they had focused this time more on factual questions about genetics and which we weren't expecting in the beginning, and but otherwise most of the question paper was from Harrison. I think even the genetics questions were from Harrison only, and so if you do your general medicine portion like the infectious disease genetics and that portion thoroughly, and the initial chapters of all clinical subjects like the initial chapters of nephro, initial chapters of neurology, I think that's very important because it gives you a general outline regarding the type of questions that are asked. And of course in every exam, so some questions will be outside, like will be more advanced and will be more difficult, but if you focus on all the Harrison related questions, you'll get an extremely good rank.
So what is your take on the percentage of questions that were asked from Harrison this time?
So I think around, I would say around 85% questions were from Harrison only. I think 10 or 15% questions they had asked according to guidelines or other things, but mostly they were from Harrison.
So you will definitely advise your juniors that the backbone of preparation should be Harrison?
Yes, sir. 100%, sir. Without a doubt.
Okay. All right. So having got such a good rank, what is the specialty that you're planning for?
I was thinking of taking endocrinology because I feel that it's more application based, and as a general medicine graduate, I'm more enticed by making a diagnosis and that.
Okay.
And otherwise, the second choice which I would like to take is medical oncology because I feel it is an upcoming field, and in our ward we have had exposure with treating patients of hematological malignancies.
Okay.
So I feel that I am adequately prepared for that also.
All right. So just tell us, see, leading to the exam, when there were a lot of uncertainties, I think practicing MCQs is definitely important. So how did the question bank, the test series of DocTutorials help you in your preparation?
So the tests, which are held very regularly and are at a good level and are mainly from Harrison, they get you into a habit of giving the tests. Like you have to attempt 150 questions in 150 minutes. So you have to be on your toes all the time, and you need to prepare how to attempt the questions, how to read the question. You make a lot of mistakes in the grand tests, so you rectify them next time. You read the questions properly. Those little mistakes of not reading except or not reading correct, incorrect, false, true, those things will only you only stop making those mistakes once you have given enough tests. And the question banks, they help reinforce your knowledge, because if you read something once, you'll never retain it. You have to attempt questions on that so that you can apply your mind, and the next time you get something like that, your mind automatically recalls that.
Okay.
So I think the test series has helped in that way.
Okay. And also, like, did the exposure that you have during your training days definitely impact your preparation in MAMC?
Yes. Actually, our second year went mainly in COVID because LNJP was pure COVID hospital. Otherwise, sir, in our third year and since we have like we had to work a lot in first year MAMC, there's a lot of clinical exposure, so you get to learn a lot. Every type of case you'll see, and when you go home and read about that case from Harrison, you are able to retain it better once
Okay.
you do it along with the patient. So instead of just going home and picking up random topics, it's better if you see the patient and then go home and you can read about the patient and the some articles related to that disease. So it helps you retain it better and you can apply it more.
Okay. Did you actually read any super specialty textbooks?
Sir, no. For this NEET exam, I haven't read.
Okay.
All
right. Okay. Now, coming to the grand test, you have given majority of the grand test in DocTutorials?
Yeah, I've given all of them, sir. Since I've joined, I've given all of them.
Okay. So just tell us, see, when you started giving grand test, how did your ranks go in the various grand tests?
Sir, I was mostly, initially I was in the 20s. Then after that, I think after the second test, I was mostly between rank 5 and rank 20.
Okay.
So I used to feel, and since there were around, I think 1,000 people give each test, so it was consistently between that.
So you were able to maintain a good degree of consistency. And
Yes,
I
sir.
think, you know, when you write an exam with good number of candidates writing,
Yes, sir.
you get to have an assessment of where you are standing.
Yes, sir.
And also, if you have any deficiencies related to any particular subtopic, you'll be able to identify that better. Right.
Yes, sir.
All right. And were you taken by surprise in the exam hall when the questions were more factual?
Yes, sir. It was more of a NEET PG exam rather than a NEET SS exam. This is what I felt like. Initially, they were mostly one-liners, and they had just asked about basic genetics, and so this is what this we weren't expecting this in a NEET SS exam. We felt that the questions will be more clinical based, or they'll be more application based.
Okay. So, what advice will you give to your juniors? Prepare for factuals, clinicals, or prepare everything?
I would say since you have to give INISS also, and that is more application based. So I would say you have to prepare everything now. You have to study like we used to study for NEET PG, and you have to learn even one-liners and factual based questions you have to do.
Absolutely right. Because see, even when I used to conduct sessions for candidates for the before the exams, I always made a point that see, the previous NEET SS exam was mostly clinical, but do not draw strong assumptions that this one also will be very clinical, because there is always an element of unpredictability. Because as you would have noticed, Ankitesh, some of the questions were very simple in this exam. Some were medium range and some were tough.
Some were very difficult. Yes.
And so it actually requires you to have a good range of knowledge. So even in DocTutorials app also, I think if you have gone through all the questions, you would have seen some of the questions are very simple questions.
Yes.
Because sometimes what happens is when you prepare for a NEET SS exam, since you know you are used to be at a particular level during your MD, sometimes it is a simple question which actually troubles you.
Yes, sir.
So it's important to be strong in all the areas, simple, medium, and also definitely the higher range topics. It's better to be, you know, prepared for all type of questions.
Yes, sir.
I definitely feel. Okay.
Prepare for the worst, sir, and hope for the best.
Yeah. All right. So see, for your juniors who are preparing for subsequent, because you have given your INI also. So
Yes,
if they ask you, is the preparation style, because INI is around 55 questions from the super specialty and 25 around from medicine.
Yes,
so what is your take on the preparation style? You know, if somebody wants to prepare, say, I want to prepare for neurology or cardiology, is the preparation style same for NEET SS, or would you suggest something else?
So for INI, you have to definitely focus more on your subject, whatever you are preparing for. There, medicine takes a second seat. And since you have already done MD, I think INI questions, the general medicine questions are mostly application based and things you have already studied in your MD. So you can just focus on subjects which you feel that you have some weakness in, you can do those, and otherwise focus on your subject mainly. All the guidelines, all the updates, because INI is mostly about updated questions, updated guidelines.
Okay.
And for NEET, you have to focus only on medicine. You can't give any subject preference over other. You have to do every subject equally, and you have to prepare every subject. You have to focus more on infectious disease and like the basic genetic stuff, since this was the pattern this time, but we don't know next time what they'll do. But if we expect according to this, then you have to do your basic medicine more, and you have to all the specialization subjects you have to focus on equally.
Okay, all right. Because I think it's also important to write exams. And I think one thing that we did in the elite exams, where we conducted the subject-wise exams, and we even conducted some topic-wise exams. Because I feel if you have some specific target set for yourself, you will be able to complete it.
Yes, sir.
So I've seen some candidates going pretty haphazard in their preparation, reading a bit of cardio, a bit of neuro. But if you have some targets, okay, I have an exam coming up, I've got to prepare for that. So I think that is something that we have done in DocTutorials to streamline your preparation better. And Ankitesh, all at home are very happy seeing the results. It's an amazing rank at the national level.
Yes, sir. Everyone is very happy, sir.
Okay, all right. Okay. So Ankitesh, thanks a lot for joining. And
thank you, sir.
Our inputs will definitely be beneficial for the candidates appearing for the subsequent exam, especially because this is a new pattern. And I'm sure many will be listening to you, wanting to know how to prepare for NEET SS. It's a completely new exam pattern. I think all your inputs will definitely help them. So thanks a lot, Ankitesh, for joining.
Yes. Thank you, sir.
Bye-bye.
Thank you, sir.
Thank you.
Bye, sir. Thank you, sir.